Welcome to another episode of Raising OKC Kids, Conversations with Metro Family in Oklahoma City. I'm Kirsten Holder, and today we're talking with Dr. Mark from Dental Depot's Northwest Expressway location in Oklahoma City. Welcome, Dr. Mark.
Thank you very much. It's a pleasure to join you today.
We're so glad you're here. So let's start with a little introduction. You are a native of Tahlequah, Oklahoma, but you did travel to dental school at University of Alabama in Birmingham, and then shortly after served as an officer for the United States Public Health Service Commissioned Corps to provide orthodontic and dental care for the Native American community throughout the country. You are married to your high school sweetheart, and together you have 3 children who now have children of their own as well. It's clear you have a servant's heart, and I would say a big one at that. You've talked in the past about wanting to become a doctor because you wanted to serve. And I know so much confidence can come from a healthy and beautiful smile. So I wondered, is that like the why behind what you do?
Believe it or not, I was in junior high at Tahlequah when I first decided that I really was interested in healthcare, and I loved working with my hands. And it kind of led me the pathway of, you know what, I can provide medical care and I can do something with my hands at the same time. So that's where dentistry was first came about in my life and everything. And I pursued a goal at that time. Our next door neighbor, he was a dentist. My brother, my oldest one, was starting to go to dental school. So I had a lot of factors influencing me. The biggest impact on where I would serve would be my parents brought me up in an environment. My father worked for the Bureau of Indian Affairs, and my mother was Native American. So most of my life growing up either on or near a reservation, and seeing so many people that were so underserved. So I really thought this would be a great opportunity to be able to give back to the community that I so dearly cherish and love. And it's worked out great. So for over 28 years with the Indian Health Service, I dedicated my service for them. Partly as a general dentist when I started, and then I received my specialty training. And for the past 28 years, I've been doing orthodontic services. And now I'm currently working with Dental Depot for the past 4 years and certainly enjoying that. So it's been a privilege to be able to give back to the community and to give to our Oklahoma City area now in return too.
I just love hearing kind of the passion and why behind everybody's story. That's so beautiful. Thank you for sharing. And you're now, like you said, at Dental Depot. You were at the 23rd Street location, but you've helped to open a new location at Northwest Expressway and 63rd in Northwest Oklahoma City, which you describe as an orthodontic focused office. Can you tell us the importance of a closed bay versus an open bay room when it comes to orthodontic care?
Certainly, when we started 23rd, it wasn't really set up for an orthodontic type clinic. They had closed bays, which we could still see patients, but not as efficient. We were blessed with being able to build a facility that is truly an orthodontic facility. We do share part of the space with the general dentists that have their own closed bay. With our open bay, it's an open concept that allows us to see patients more efficiently and more effective. So when a patient comes in, we do provide a private area for them to have their consult in, to go over their diagnosis and to financial arrangements and everything. After that, they enter this open bay concept where they can interact with the staff, where we also have the ability to see patients more efficiently. So instead of having to wait for a doctor to go from one room to the next room to the next, I'm on the floor. I'm able to move very efficiently from one patient to the other. So one, it reduces the time you're waiting to see the doctor and the time to the auxiliary to step in and be able to provide the treatment that's needed and get the patient on their way. So it reduces the overall wait time for the patients. The patients enjoy the open bay concept. There's a lot of fun interaction that goes on with the staff and sometimes with the patients. It just makes it for a fun environment, one that's very effective and efficient in providing orthodontic care.
That's great. Yeah, no one likes to wait. And then it sounds like kind of the open air environment provides more of like a family environment where you do get to talk with people and kind of hear what's going on and ask questions.
Exactly.
That's great. Well, many of our listeners are parents, as you likely know, and some parents of an age group that might be starting to think about orthodontic care for their kids. When you do recommend that parent, or I'm sorry, when do you recommend parents bring in their kids to get an orthodontic evaluation? And maybe tell us a little bit about what that first visit looks like.
Excellent. Um, the American Association of Orthodontists, which I'm a member of, along with the American Board of Orthodontics, strongly recommend that all children have an orthodontic evaluation by age 7. Why? Because at that age, typically the permanent first molars in the back have erupted, along with the central incisors and lateral incisors on the top and on the bottom. So we have the foundation of their teeth starting to develop along with their jaw structures. This evaluation can be done by the general dentist at age 7 or done at the orthodontic office. At our office, we do provide a no-cost consult where we'll bring the patients in, we'll provide them with the records so we can do a complete assessment to see exactly what's happening with the child or the patient. At age 7, as I mentioned, is probably about the earliest age. It allows the patient to be able to be at that state where they can recognize some of the problems going on, along being at an age where they can start with the cooperation. We do need some help from the patients. The nice thing with orthodontics is we tend to be non-invasive. That means the patients don't have to worry about getting shots, don't have to worry about having teeth taken out by us. We're here to help their mouth become a better mouth so that they can be able to chew, be able to eat, and have that beautiful smile that they've always wanted.
Yes, yeah, and that's a good point. You're not going to see the orthodontist to get any kind of painful procedure, at least for the meantime. So that that is probably a perk to your job.
Well, during your first visit, many of us remember it could be a little traumatic because one of the things we need to do is see what your teeth look like outside of your mouth. And traditionally, we would take impressions. And most everybody listening has probably experienced that. And it's nothing any fun. You gag, there's potential for throwing up, and it's just no fun. Well, one of the beauties of today's technology is that we've done away with taking impressions. We're completely impressionless. We use a digital scanner. What that digital scanner allows us to do is capture an extremely accurate image of all of the teeth and how they fit together. The other part is once we've captured that image, we're able to immediately transmit that to the company, and the company can start working on the case right after they receive my prescription that goes with it there. So that's something that's been great as far as eliminating that little fear of, I don't want that stuff in my mouth, I don't want to throw up and all of that. And then the other nice thing about it is the fact that if we need to do some touch up, then we're able to do a new scan on the individual and continue care. When we get all done and ready for things to come off, we can do a final scan and then get the retainers all made. They can remove all the attachments. So when the patient comes back, we're able to take off the attachments and deliver the retainers.
I like it. Nice, painless, easy. It seems like that's how the way of the future is going with Invisalign.
Exactly. And it's been exciting to watch the patients that accept that. And that's some of the hesitancy is like, I don't want to have to go through impressions. It's like, we don't have to. We've done away with that.
So I just have a little toddler at home. And when you say age 7, it makes me a little bit intimidated because it's just, I know it's just not so far around the corner. As he's growing up, are there any signs that I should look for as indicators that he might need braces as he grows older?
Certainly, there's several things that we want to try to identify early on. And to help parents understand that, we'd like to walk them through a little step of take a look at your child's bite. Do the teeth come together when they bite? If they don't come together, they might have an open bite. It could be because of a thumb or finger habit. It could be the way the jaws are developing. They also might bite down and the teeth overlap excessively. That's called a deep bite. And the problem with that is it locks in the lower jaw and prevents it from developing like it should, which can cause skeletal issues as they continue to grow and develop. One real common is an excessive overjet where you see kids with the front teeth sticking out excessively far. And in these circumstances, it's usually can be a dental problem or a skeletal problem. And that's one of the things you want to assess to see if we can simply correct it orthodontically, or do we need to do some orthopedics and change the way they're growing and developing. A severe overjet in most of those cases, and about 70% of those cases, usually result in some type of traumatic problem if it's not corrected. And in about half those cases, those kids are more prone to damage as they're growing and developing. Why? Because if a child slips or falls, Those front teeth are the first thing out there, and they're most prone to being fractured or damaged upon a fall. So that's one of the reasons for getting that corrected. Other problems are the teeth could be in crossbite where they don't overlap correctly there. So there are a number of problems that can be identified early on and made a decision, can we do things orthopedically or orthodontically to be able to start to correct those so the problem will be less severe when the rest of the permanent teeth come in, or maybe have it corrected so that they won't need additional treatment by the time all the permanent teeth come in. So those are some of the advantages. With my own family, I've taken all my kids through it, and I've got 3 beautiful grandkids, and their ages 7, 10, and 12. And all of them have been extremely receptive to orthodontic care. And a little bit later here, we can discuss the type of treatment that I actually provided for them.
Yeah, I would love to hear about that. I'm sure you have the best looking teeth on the block as far as your family is concerned. Yeah, so kind of preparing, as I'm like mentally wrapping my mind around this, and you're saying age 7 and kind of looking at the bite and all of that. Should I start saving now? I don't know how expensive to expect for a kind of treatment that might start earlier on.
Right. It's always great to have some kind of savings in store. It's going to make that impact of making that decision a little bit easier. But we realize so many things going on, especially with the whole COVID situation, with the economy. People are trying to be very careful with what they spend it on and how they spend it on. You want to invest in something other that's going to give you a big return. Well, this is a lifetime return that it can provide. And if you have the resources to allow you to be able to do that, it would be a great investment. People always ask, well, how expensive is this going to be? Just as you alluded to there. If we start somebody early on, the cost can vary. All of this will vary depending upon the severity of the case and what is going on, but it can start around $2,500 to get kids underway with initial phase. And then if they do need additional phase, one of the beauty of, if you've started our work with us, we're going to provide you a significant discount then if you do need to go into a second phase of treatment. Typically, a comprehensive level treatment will begin somewhere around $5,000 and go from there. So a lot of it depends upon how severe the case is and how soon that we're treating them. In some cases, we might defer and just say, hey, we've identified some problems, but right now it might be best just to wait until they get a little older and the rest of the teeth come in, thus saving you some money and being able to treat them all at one time. But without having some type of consult, we really can't do that. And that's the importance of seeing a child early so we can help make those decisions.
Sure. Yes. And I know you have year-round incentives and promotions you all do. For example, you just hosted Invisalign Days very recently at your new location. And for those of our listeners who might be interested in Invisalign, either from a parent perspective or a child perspective, can you tell us who is kind of the best candidate for Invisalign versus traditional braces?
That's a great question. And our practice has really transitioned along with many orthodontic offices to the fact that with clear aligners, we're able to deliver care that's almost identical to the care that we could deliver with braces before. Some of the advantages, we use Invisalign at our office, and some of the great advantages is some of the new technology that they've incorporated. And at this point, we're pretty well able to do most cases that you would traditionally do with braces with Invisalign. And what's some of the advantages for that? One, the aesthetics of it. Most people don't even know that you're getting orthodontic work done because the aligners are clear. The other thing is you don't have the hardware attached to your mouth there, so you don't have to worry about, with Invisalign, with the clear aligners, there's no brackets to break off. There's no brackets to attach where the food could get caught, where plaque can build up. So hygiene's a huge benefit with Invisalign. Taking care of them and not being able to break things, a huge benefit with them. The other thing that's significant is treatment time is usually greatly reduced with Invisalign, because with Invisalign, you are trading out your trays that are causing the movement every week. So every week you're getting a new set of trays there. With traditional braces, we're going to see you back about every 6 to 10 weeks to make adjustments. Those adjustments cause the teeth to move, then they kind of recover from that, which take a longer period of time. So with Invisalign, we actually can deliver care at a little faster rate than what we typically would deliver with braces. I personally have done several orthodontic cases, surgical cases. We've done cases with impacted teeth. So really, there's nothing off the board. We give patients that option. The biggest drawback with Invisalign, if you don't wear the trays, it's not going to work. So we just have to have that commitment. And that brings up the questions about, well, you offer younger kids Invisalign now, which we do. We offer teenagers, and now we've offered Invisalign first. And our office was the first office in Oklahoma to be able to start this last year with Invisalign first. And it's been nothing but a success. The parents love it, the kids love it. Probably one of our most cooperative groups. Believe it or not, those little guys between 7 and 11 years of age, they are more committed to wearing it than some of our adults. So they're excited about it. I had this one little girl come back the next day and said, yes, first thing I did was go in and showed my teacher, and the teacher then showed me her mouth, and she had Invisalign, and she goes,
Oh,
like my teacher. So that was awesome.
yes.
Part of the incentive too, Invisalign now has reached out. They realize this young market is there. You can go to their online site, their store. You can actually order stickers. They have thousands upon thousands of different stickers. So for these younger kids that, well, I want the little colored rings that go around my braces. Well, now they can get whatever sticker, from emojis to animals to stars. And now they can decorate their liners each week and have something different. So that's part of the incentive with getting the little guys involved with this.
I had no idea little kids were able to do Invisalign. That's great to know, and even better with all those personalization incentives. I know that was a big deal when I was younger, what color your braces were going to be, or what color you were going to get when you switched out your rubber bands. It's all about that personalization.
Right. And the stickers are not off limits for teenagers and adults. So we let them know that it's like, hey, if you want to have a little flair, a little pizzazz, you can put a star on your liner and you can show off too. So
Yes, that's great. Little something to make you happy and keep you accountable, maybe too.
exactly.
So fall is a good time to talk about protecting kids' mouths who are playing sports. And you kind of mentioned that when we talked about the extreme overbite. Do you have certain mouth guards that you usually recommend for people, maybe just regular people without braces or with braces, protecting that as well? And what should our first steps be as a parent if our child does have an impact injury in their mouth while playing sports, or if they damage their braces while playing sports?
You bring up a very good point. I know the American Association of Orthodontists have really made a big push in protecting kids' teeth, especially when they're wearing orthodontic appliances. One of the brand names out there is called the Shock Doctor. You can go to many of your athletic stores here in town and be able to purchase it. Just about all of them carry it. The Academy store directly across from Dental Depot on 63rd, they have a well-stocked supply of it there. And what they're made is to actually fit over the braces. A typical mouth guard that you would buy for playing football, basketball, has to be fitted for the mouth, has to be heated up and boiled, and they bite into it. Unfortunately, that's going to restrict the movement of the teeth and keep them from moving. So the Shock Doctor and ones like it, they're basically made with a protective gel around there that fits around the braces and around the teeth to allow the person to continue to wear their appliances, but also protect them. The last thing you mentioned with impact, that's so critical. We tell all of our patients, if you're going to participate in a contact sport, whether it be football, basketball, softball, anything like that, that runs that potential of a mouth injury, you need those teeth protected there. And in the event that the child's not wearing it, or sometimes a nice long run and you trip on a rock and you fall down and bang, those traumas can be significant. And if that happens, one, if it's so severe it knocks a tooth out, first thing to do is recover the tooth and find some milk, rinse it off in the milk, and then store it in some milk. That'll keep that tooth vital for about 6 hours that it could be reimplanted there. If you're someplace and you don't have anything to put it in, try to rinse it off and put it in your mouth. It sounds kind of gross, but stick it in your cheek and hold it there until you can find some milk. We don't recommend holding it there too long because we don't want you to suddenly swallow it and now you don't have a tooth any longer. So But if it's fully avulsed or fully lost, that's one of the recommendations. And then immediately seek out medical help. If necessary, call 911, find out where you can go. Most time it's going to be the emergency room. If it's during the day, the dental office usually are prepared to be able to handle those type of emergencies. After hours, it might be faster to go to the emergency room. They're fully trained on what to do with a tooth that has been knocked out. So those are some things that can be helpful. If the tooth has been avulsed but not completely knocked out, in other words, it's coming loose and it's flared out, sometimes gently putting a little pressure to push it back into place can help maintain that tooth. But at the same time, call your doctor's office, call your dentist, and get an appointment set up so it can be looked at as soon as possible. So if there's any damage being done, they can address that, or they could stabilize the tooth there.
Those are really good tips. I have seen a case in which there was an impact injury, and like you said, it was running, falling on a rock. It wasn't something to be prepared for in advance,
Right.
where there wasn't, much trauma initially or seemingly, and then days later there was some discoloration. Can you speak to that at all?
Certainly, any trauma to the teeth, because the teeth are vital, they've got a nerve and a blood supply inside of them there. If that's disrupted, it can cause the tooth to lose that vitality. And sometimes you'll get the discoloration from the blood basically no longer circulating in the tooth. In these cases, the tooth needs to be looked at and treated. In those circumstances, usually the tooth can still be maintained or saved by having a procedure called a root canal treatment, where the tooth is opened up, the nerve inside is cleaned out, the tissue's cleaned out, and then a filling material is put in. Doing so allows the tooth to be preserved. The nerve that's inside the tooth is just one of the nerves. You got thousands of nerves surrounding the teeth with the periodontal fibers. That's what actually allows the tooth to move in the body. That's what we take advantage as orthodontists, allowing us to move the teeth throughout the bone there. And those periodontal fibers can be damaged too. And that's the reason why it's important to follow up, not only for the health of the tooth, but the surrounding tissue around the teeth, the gums themselves there.
Absolutely, lots to look at, and not most of it, I believe, is apparent to our eyes, not our untrained eyes. So it's good to have people like you that we can count on. So I'm not the only one in my household who gets a little nervous about the dentist, and even more so now that we are all a little hyper conscious about germs. You did bring up the point though about how usually seeing an orthodontist is mostly pain free. So, but even still, I'd love to know more about what practices you have in place in your office to keep families safe and at ease.
Certainly. We are at Dental Depot in all of our locations. We're following all the COVID-19 regulations put out by the CDC. That's one of the highest standards here. All the patients that we see when they come in, we ask them and screen them about any exposures. Last thing we want to do is bring somebody in that could have an active case going on there. So we screen the patients and the staff as well. The staff is fully masked at all time. We maintain all the units in a very disinfected environment there. When a patient comes in after they're treated, every instrument used is sterilized. The whole unit that they were at, anything the patient could have touched is disinfected. And being in an open bay, you might wonder, it's like, well, is this safe? All the chairs are over 6 feet apart, so nobody is going to be in contact with another patient that is not within that boundary of 6 feet there. So we're trying to go above and beyond to be able to look at the protection for the patients, our staff, and be able to have a safe environment there. We encourage patients to have masks and everything. Yes, we can't work on you with a mask. I'm sorry. We're going to have to ask you to slip it down. But all of our staff will always have a mask on at all point to keep it safe. As you mentioned earlier, one of the advantages with an orthodontic office is the fact that you're here to get your teeth straightened. We're not here to give you shots. We're not here taking out teeth or doing other invasive procedures. So with that being said, that also helps reduce the amount of contamination that would be generated in a typical office where they might be doing cleanings and extractions along those lines of care. So we can provide you with a very safe environment that you can come into without a concern of having the risk of being exposed unnecessarily.
Thank you for sharing that. I'm sure that helps us all kind of wrap our mind around what that visit will look like and how we're going to be safe doing that. So we mentioned this a little earlier, but I want to talk more about your family. Your children and grandchildren, I bet, just have shiny, beautiful, straight teeth. Is that right? Um, did you start talking to your kids and grandkids about dental health and orthodontic health at an early age? What did that look like in your family?
Absolutely. They knew what dad did, what papa did, and they were always interested in it. And I will tell this for any parent, early exposure is the best. You don't have to wait till they're 7. Don't wait till they're 7 for a dental examination. As soon as that child is walking is a perfect opportunity. Talk with your local dentist, talk with your hygienist, say, hey, I've got a 2-year-old. Could I bring him in for just a quick, sit down in the chair and open up my mouth, to see if they will. The sooner that they can get accustomed to know, hey, this can be a place that's okay. They're just going to take a look. The sooner they get that environment in, it's less of a threat to them and they tend to have a much better experience. And the other thing is oral hygiene is so critical for success of treatment and for the success of reducing other disease process going on. Um, as a parent, I know it's no fun brushing your kid's teeth. Okay. I have brushed my son when he was 13 years old because he wasn't brushing it. I told him, he goes, well, good, go ahead. I said, okay, I will. We're going to do this every night. And it's like, yeah, I don't think so. It's like, exactly. So don't be afraid to look in their mouth. Don't be afraid to tell them, hey, listen, you got to do a better job. If not, you're going to inflict your own pain upon yourself there. So trying to educate them to how important that is. As far as getting your teeth straightened and all that, I want to say, aesthetics is really important. We all love a beautiful smile. We love to see people's teeth nice and straight, but we're also wanting to make sure people have correct function, that they're able to talk and chew and eat. And the nice thing about orthodontics, when we put the teeth in the correct alignment, the aesthetics are going to naturally be there. So in return of not only having teeth that come together, that they function like they should, you're going to have a beautiful smile that goes with it too. So that's something we encourage, the kids with. All of my older kids were really before the advent of Invisalign really took off. So most of them, they were done with traditional braces. But all my grandkids have been through Invisalign, including the little 7-year-old. She started when she was 6 and she was like, Pop, I don't know about this. And it's like, it'll be okay. And now she absolutely, loves it. They wear their trays all the time. They do everything that they need to, and they've had some outstanding results. So I've been really excited about that. With Invisalign, it has just taken off. I'm proud to say Dental Depot, we hit this year and everything in the top tier level at the 1% of the highest, producing for Invisalign. So it's really taken off here. Dental Depot's embraced that, and I'm just excited to be a part of that and working and seeing, smiles being changed in a positive way. And where we can offer something in the way of Invisalign where they don't have to worry about breaking braces, they don't have to worry about the anesthetic part, don't have to worry about their diet. It just makes me feel good knowing the patients feel good they have an alternative versus the traditional braces there.
Absolutely. It's nice to have options, no matter what it is, but
Exactly.
especially when it's something you're using every day. It's
And don't
right
get
on
me
your face.
wrong, we will still have patients come in and says, no, I'm not going to wear my trays. I just want to do braces. And that's okay. Everybody needs to have some options and we understand. I want people to be honest with me. If you don't think you're going to be committed, let's not go down that path. Let's just get you started the way that we know it's going to work for you.
Absolutely. Well, thank you so much, Dr. Mark. I really appreciate you sharing your knowledge, but your passion also with us today. It really shines through your care and your practice, and that's really refreshing to see. It's been a pleasure getting to know you, learning more about your family, and I appreciate you personally helping me get prepared for my probably numerous orthodontist visits in the future. For those of you listening, you can learn more about Dr. Mark and his new practice at www.dentaldepot.net. Click Find Your Location and search for Northwest Oklahoma City. Again, he is situated at Northwest Expressway and Northwest 63rd Street. Thanks again, and join us next time on Raising OKC Kids.